Eric Johnson, and I'm here today with Scott Breece. Scott is the CISO and VP of Security for Community Health Systems. Community Health Systems is a major hospital operator with over 119 hospitals in 20 states, 20,000 licensed beds. And Scott is also a member of our executive advisory board for our CISO workshop series. That series is funded by the National Science Foundation, part of a project called Trustworthy Health and Wellness. I'm delighted today to be here with Scott here at their corporate headquarters. Welcome, Scott.
Thank you very much, Eric.
Well, Scott, health IT is transforming the healthcare delivery system, really improving outcomes and the healthcare experience. How do you see health IT impacting community health systems?
We see health IT impacting healthcare three different ways, really. Big data is one. The interoperability piece of analytics across all the systems helps us make better informed healthcare decisions, especially in the patient care delivery cycle. The Internet of Things is big. A lot of people are mobile this, mobile that, and so a lot of new apps are coming out with a lot of these different applications and systems we use in our hospitals, clinics, and outpatient services. And then I'd say the third piece really is around telemedicine. We're starting to see more of a trend towards the telemedicine so that you can be anywhere in the U.S., the world, and pull up your iPad and have an interaction with your physician related to a diagnosis or just not feeling well. So those are the three big trends we are seeing that healthcare has a
and all
positive
three of them
impact.
having really big impact on patients.
Absolutely.
Well, of course, security is always a concern when you start talking about health IT, and
Absolutely.
so beyond the patient data threats, threats to their identity, what kinds of threats do you see to the healthcare delivery system?
So a lot of services and solutions are obviously going to the cloud. We've been saying cloud for some time now. So,
But it's real now.
It is real. It is real. And I think one of our biggest challenges is trying to maintain an inventory of where our data is being processed, stored, or transmitted. For example, we just talked about mobility, Internet of Things a minute ago. A lot of those data points have to go to a third-party service for the delivery to the app on their phone or their tablet or even their laptops or even into their homes. And so inventorying all that, maintaining where it's going, who's accessing it is a big threat to us. We always have to throw humans in there, right? And then you combine that with email. And so I'd say the human interaction with email, phishing obviously is a major threat for us. So humans and email combined form the phishing threat in our environment. And we also see a lot of trends with individuals clicking on those phishing emails that generate the malware or some other entry into our network, and it generates a lot of work for us. So humans and email combined are a major threat that we see. That is
most of the time they're after patient data, right? They're trying to steal your identity somehow.
Right. Yeah, they're trying to establish a foothold into the environment and to be able to perform lateral movement from there.
Yeah,
absolutely. And then the third threat we see quite a bit is medical devices, which everybody is talking about right now. A lot of those devices are becoming the Internet of Things. They're attached to the wireless network. You have the ability to compromise a device and impact a patient life. So we've been working diligently with the appropriate teams inside our organization to develop an inventory, maintain that inventory, track those devices, categorize the ones that have an impact on a human life, and make those our priority first.
And these would be
address.
everything from infusion pumps,
correct, heart monitors,
anything you'd see in a hospital room.
Right. Yeah. Medical devices at the bedside. Scanners. Barcode systems. Those are the types of things that we have to make sure that we're segmenting from the network and creating the necessary enclaves to secure them.
So what are some of the particular security initiatives that you're really excited about?
The first one that comes to mind is our governance, risk, and compliance tool. Healthcare is heavily regulated for a lot of good reasons, and then there's some regulation that is quite burdensome, and most organizations are reacting to an audit, to an assessment, whether that be internal or to a third party that they do business with, and that to me is reactive compliance. And so we're using our governance, risk, and compliance tool to help drive the change in culture from reactive compliance to proactive. So if we create dashboards and daily reports and use a lot of automation for remediation as part of that tool, then we can change our culture to be more compliant than not.
So looking ahead, are there any particular trends that you're watching and maybe advice you'd give some of your colleagues at other healthcare firms for initiatives they should be considering?
Yeah, I'll go back to the third party cloud. We've seen a significant increase in those services and solutions in our hospitals, especially in some of our rural areas where we have clinics or outpatient services close to a hospital but not connected to a hospital. We still have to deliver services for the patient care. That gets back to making sure you know what services and solutions you're contracting with, who's contracted, what data types that are being sent to them, performing security risk assessments on their environment, having the ability to perform an on-site audit if you needed to, or obtaining a third party to execute that audit and produce the results to make sure that they're still compliant with your standards. The other thing we're really working on heavily right now is making sure that as we get all these Internet of Things in, how do we develop standards through the architecture and engineering process and enforce those by building the right monitoring controls, making sure we lock them down as much as possible, have the ability to wipe a tablet or a cell phone, or even securing, like I was saying earlier, creating the enclaves to mitigate access to the actual medical devices that can impact a patient life. And then, our standard operating procedure around keeping up with industry trends of what's going on around the world, different attacker groups, anybody from the Russians to the Chinese, and we really work hard to make sure that we have the right intelligence and put the right controls in place. Not necessarily to block all the time, but to at least mitigate the risk as much as we possibly can. The old adage is it's not a matter of if, it's just a matter of when. So that keeps me up at night.
Sure. Sure.
Some of the other things that we're looking at is one of the big ones we've noticed here lately is what we call shadow IT, where we see different business units hiring a different skill set to help build databases for reporting, and that just creates duplication of patient records, and the systems may not be maintained appropriately, and so that's an area of risk that we're working to force people to go to a centralized environment, enterprise data warehouse type of environment that you can standardize the reporting.
And lock it down.
Right, absolutely, lock it down, and that goes back to that big data, the analytics.
Yeah.
So then everybody can be using standard reporting format to make the right decisions for all of our business units. So it's something we maintain and track. As new environments are built in our data centers or even at our local hospitals.
Now, Community Health Services has won some awards for work you've done in identity and single sign-on. How does that help security, and how does it help patients?
So from a security perspective, we can automate the provisioning and deprovisioning of users. So think of it like lifecycle management. So from a security standpoint, that gives us the ability to make sure that we provision based on your job code, and you get access to the minimum necessary systems and applications to perform your roles and responsibilities in the organization. From a patient perspective, the clinicians who are the caregivers in our hospitals or clinics or outpatient services, they have the ability to remember one username and password, but then we layer it with the ability to badge in and out of the systems throughout the day, to auto launch those applications, put the caregivers right into the application up front so that they can focus their time on patient care delivery.
So in the past, they might have been having to remember lots of passwords and entering them all the time to get into different systems, and that slows them down.
It really does, yeah. So when I initially was part of that project team, 13 to 14, sometimes maybe 15 or 16 usernames and passwords. And, if it was manually being provisioned, they weren't necessarily resetting them across all those environments. So the physician really did struggle, or the clinician, whether it be a nurse, radiologist, somebody in the lab, they actually had to remember that many different passwords. And so it has streamlined that process. It's reduced their login time and put them directly into the applications that are the priority in their department that they're working in.
Well, Scott, thanks so much for chatting with us today.
Yeah, thank you for having me. I really appreciate it.